Do you have to worry about saturated fat on a ketogenic diet? Well, ketogenic therapy can put treatment-resistant mental illness into remission and can eliminate type 2 diabetes. It can be a life-changing therapy for many, but many versions of keto diets contain more saturated fat than is commonly recommended, something most doctors and dietitians will say is a health risk. But is it really a problem? Probably not, actually. So let's get into the details that you need to know. Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. Before we get started, please remember our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have potentially dangerous effects if done without proper supervision, so consult your healthcare provider before changing your lifestyle or medications. In addition, please recognize that people may respond differently to ketosis, and there isn't one recognized universal response. Why are we even talking about ketogenic therapy? Well, emerging research and clinical experience indicate that ketogenic therapy can be a dramatic and life-changing treatment for many living with serious mental illnesses like bipolar disorder, schizophrenia, major depression, among others. And ketogenic therapy is rooted in a ketogenic diet. Now, it's important to clarify that there is not just one ketogenic diet. Someone can achieve nutritional ketosis with a vegan, vegetarian, Mediterranean, omnivore, or carnivore diet. So if someone is truly concerned about eating saturated fat, that in no way precludes them from pursuing ketogenic therapy. I can't stress this point enough, as many people, dietitians, physicians included, they dismiss ketogenic diets out of hand due to concern about saturated fat, and that doesn't have to be the case. But if someone wants to eat a keto diet containing saturated fat, is there by definition an increased risk? Let's dig deeper into the science, and you'll see that as we sort of peel away the layers of the scientific onion, so to speak, that the risk really tends to disappear. So first, we have to understand that the majority of the evidence suggesting eating saturated fat increases heart disease comes from large population nutritional observation studies. And as we've mentioned before, these studies are considered low-quality evidence. Now, that's not a judgment. It's just how they are assigned based on the data's strength. The studies have inherent weaknesses, such as the data collection is low quality with subjective food frequency questionnaires that happen only once or twice usually. There's a big problem with healthy user bias, since in the general population, those who eat less saturated fat tend to be more health conscious. And the impact tends to be maybe statistically significant, but at a very low level. So it makes it uncertain what, if any, effect it will have for each individual. And even with all these issues, the data aren't consistent, as many studies demonstrate no increased health risk with increased saturated fat intake. For instance, a 2009 meta-analysis of 28 cohort studies and 16 randomized controlled trials concluded the available evidence is unsatisfactory and unreliable to make judgments about and substantiate the effects of dietary fat on risks of heart disease. And a 2010 meta-analysis of 21 cohort studies found no association at all between saturated fat and intake on heart disease outcome. A 2014 systematic review and meta-analysis found that the evidence does not clearly support the dietary guidelines that limit intake of saturated fats and replacing them with polyunsaturated fats. A 2015 meta-analysis of 17 different observational studies found that saturated fat had no association with heart disease, all-cause mortality, or any other disease. And a 2017 meta-analysis of 7 cohort studies found no significant association between saturated fat and heart disease death. Now, to be clear, there are many other observational studies that do show an association with increased heart disease risk from saturated fat. I'm highlighting those that don't show the association, since it seems these are discussed much less often, since they don't fit the common narrative, but it's important to know they exist. And look, regardless of the study conclusion, there may be concerns about how much saturated fat were they eating, how long was the study, who funded the study, and others. So it's important to weigh all of the evidence that's out there, whether you agree with it or not, right? Now, let's admit it, nutrition science can be messy. But there's more to consider than just the outcomes. For instance, where did the saturated fat come from is key. The most common sources of saturated fat in the U.S. include pizza, desserts like cookies and cakes and pies, mixed meals like the classic burger, fries, and Coke, or noodle and rice dishes that also contain meat. So we can rightly ask, how does data where these are the most common sources of saturated fat, how does that data translate to someone being proactive about their health and eating a low-carb diet higher in saturated fat? The overwhelming majority of the data from the observational studies tells us nothing about this population. Instead, most low-carb or ketogenic studies that don't limit saturated fat demonstrate dramatic metabolic health improvements, and some even show a reduction in overall cardiac risk. And remember, that's with no limitations in saturated fat. So there's a little bit of a disconnect, because getting your saturated fat from cakes and pies and pizza is very different than having a steak with broccoli and Brussels sprouts and green beans and avocado, right? Those are two separate things. We can't treat them all as the same quote-unquote saturated fat. But I want to use one example to sort of better demonstrate the evidence. And this is a 2020 Cochrane review analyzing randomized controlled trials of higher versus lower saturated fat intake. Now, randomized controlled trials, or RCTs, they're a higher quality of evidence than the usual nutritional observational studies. And the Cochrane review demonstrated that there was no difference in total or cardiac mortality or cancer risk for those who ate more versus less saturated fat. Now, there was a very small increase in the combined cardiac events for those who ate more saturated fat. But here's the interesting part. They looked at 12 studies to make this conclusion, and of those 12 studies, 9 demonstrated no difference, and 3 demonstrated the small increase. So only by combining all of the trials together did they find a very small increase, despite the majority of the trials indicating no increased risk. And if we peel the onion back a little further, it appears that only those who saw an increase in their LDL cholesterol had an increased risk. And even then, it was a small increase. And let's keep in mind, again, these were all high-carb, high-fat diets, not whole foods, low-carb diets as part of ketogenic therapy. So without making this too confusing, hopefully you can see the data as they apply to an individual get weaker and weaker. But that does not keep clinicians from proclaiming that we should all eat less saturated fat as if it's the highest quality evidence that affects all individuals the same, which is simply not true. So what's the takeaway? Well, I think when there's this much discrepancy, we all have to make up our own minds. But my takeaway is that I don't worry about saturated fat in and of itself. I pay attention to the entire dietary makeup and its impact on someone's health. For instance, is someone eating a whole foods, low-carb diet, high in saturated fat as part of ketogenic therapy? And have they put their depression or type 2 diabetes into remission? Did their metabolic health improve, thus reducing their cardiac risk? Do they enjoy their diet and think they can stay on it long term? That's what I'm looking for. That doesn't mean I'm going to ignore cardiac risk markers. Of course not. I'm paying attention to those as part of an overall health assessment, as we should with any treatment intervention. But in this setting, there's no quality evidence to suggest there's something magically dangerous about saturated fat. It's the effect it has on our bodies that we can measure. And the same can be said for carbs, right? We did another video about, are all carbs harmful to our mental health? And the answer is that they may not be. The keys are determining what kinds of carbs, what does the rest of the diet look like, and how does it impact someone's overall health, including their metabolic health. And it's the same for saturated fat. Where's the fat coming from? What does the rest of the diet look like, and how does that diet impact one's overall health? It's pretty simple when we think about it that way. I wish more health professionals were open to seeing it that way as well. So as always, we hope you found this helpful, and if you did, please like and subscribe, and please share this with anyone who you think may benefit, and please leave us a comment, as we would love to hear from you. Thank you for watching. I'm Dr. Bret Scher, and we'll see you here next time at Metabolic Mind, a nonprofit of Bazooki Group.